suspected neurodivergent symptoms and lied to my doctor. My name is Marcia, and this channel is about the neurodivergency in you and claiming that, right? No more hiding from it. And I want to discuss the reasons why I hid from mine in this series and kept lying to my doctor. So, the number eight reason why I lied to my doctor about the symptoms that I was experiencing is I didn't want the doctors and the nurses to look at me differently. And I brushed over this in part seven. Let me tell you, it just depends. Sometimes you can go to a doctor's office and the receptionist, the personnel, the patient access person, or should I say patient access employee, the technicians, the nurses, and then the physician assistant or nurse practitioner or the doctor, sometimes they can be cold. They can show nonverbal communication of judgment, and they can ask really, in my opinion, really rude and unnecessary questions. um, but I'm starting to realize after working in the emergency room that with every question they ask, there's a reason for it. There's a reason behind it. And they don't know you, right? Unless you're a family doctor or you have the same PCP for years. So they kind of have an idea of who you are, but they really don't know you, right? They're strangers. So they feel comfortable, whether they are aware of it or not, or conscious of it or not, to, give you that microaggressive, passive aggressive look of disappointment and disapproval. And then, if you're really, really close to your general practitioner, they're a little bit more hesitant to do that. And then there are other times where they're completely open and they're completely warm, they're eager to help you, and they will open up about their own experiences. I've had that. Many nurses open up about their symptoms of ADHD. I know when I had a hysterectomy and I was getting my ultrasound, the technician who was completing my ultrasound, I told her I was really scared. What do you think about it? Have you met anyone or spoken to anyone intimately about having a hysterectomy? And she flat out said, I did it. It was the best thing I ever did. My health was in decline. And after that, my health started getting better. And I was able to come to work and function properly and not be in pain all the time and hiding in the bathroom crying. So sometimes you really do get little blessings in your life, right? At these doctors' offices. And other times you don't. And so that's one of the reasons why I lied to my doctor, because I really did not want the staff to look at me differently. I am already on edge, right? No one wants to go to the doctor's office. I know I don't. It's not like going to the beach, right? You know there's going to be some sort of blood test. You know they're going to ask intrusive questions. You know you're probably going to get on that scale. They're going to take your vitals, your blood pressure, your temperature, all of those things. You know they're going to compare it to your last visit and ask you what stressors are going on in your life that elevated your blood pressure, that caused an increase in weight or decrease in weight. You know that you'll have to answer these really mm, I don't want to, I know I used the word intrusive, but I would say personal, right? Questions. And in your back of your mind, I know in the back of my mind, I was thinking about all the things that I wasn't supposed to do that probably caused my vital signs to shoot up, right? And now I have to explain that to the nurse. First, I have to explain it to the technician who takes my vitals, and now I have to explain it to the nurse and then to the doctor. It's like, golly, how many times do I have to, talk about this? So I'm already frustrated, I'm already annoyed, and I just want to get out of there. And then if you are not in a small town, I'm in a very rural town. Uh, so the wait is not long, but the state I was living in prior, the wait was always long. So you're just waiting there, and your anxiety, your headache is just getting worse and worse. And all of your worst fears are bubbling up to the surface. And I have that going on with me. And then I think that exasperates my fear of the medical staff looking at me differently, right? I think that maybe induces some sort of paranoia, right? And they may not even be looking at me differently, or I'm perceiving in my mind, right, that they may if I tell them the truth, and that may not be the case. So, if you for me, my symptoms of ADHD was hyperactivity, inattentiveness. I remember the first psychiatrist I spoke to, I told him that I had trouble focusing, and I would wake up for work sometimes and just sort of sit there, like staring in outer space. Sometimes I would stare at the floor trying to remember what it is I need to do for the day, right? I know I need to get up, or I know, right, that you're supposed to get up, and get dressed, right, and take a shower and brush your teeth and all that. But I just couldn't move because I was just staring out in space. Um, Sometimes I would forget things, like my water bottle, my lunch, because I'm rushing, right? And that's part of my ADHD. Sometimes I wake up really excited and I've got this burst of energy from out of nowhere, and I'm just in a rush and I'm not able to just calm down, take a deep breath, regulate myself. My hormones are all out of whack, and then of course I forget vital things that I need for work. So I'm going into the doctor's office knowing that my life is a mess, and then I'm supposed to like open up to you and tell you that? No, thank you. And then I'm just supposed to sit there while you judge me. So those are the type of thoughts that was going through my head. So I just want to encourage anyone out there in YouTube land, if you feel that the medical staff is going to judge you, treat you differently, look at you differently, ask you sarcastic questions, the best thing you can do if you don't feel comfortable is to change. Your primary care physician. If you don't feel comfortable, you don't need permission. All you got to do is call up another office, and say, hey, are you accepting any new patients? And they'll say yes or no. If they say no, just call another one. If they say yes, say, I'd like to schedule an appointment, and they will take your name, your date of birth, your address, your phone number, your email, and they will schedule you when the physician is taking new patients. It might be right away. It might be 6 months out. So be prepared for that. And then they'll ask you what type of insurance you have, and get the ID number off of your insurance card. And then they will mail you, which is the reason why they ask you for your address. They will mail and email and text you the new patient paperwork. Please go ahead and fill that out as soon as you get it. Don't wait until it's close to your appointment to fill that out. If you are rushing a day or two before filling that out, you're going to just answer anything because you don't want to fill that out. And I've done that before. So don't do it. In order for you to get the help you need to fill it out accurately and precisely. as best as you can, right? You may not remember or know a lot of things on there, especially about your family history, if your family is keeping it, hiding it, denying it, lying about it. But you can answer the questions the best you can about yourself, right? Because those medical forms are really about you. So don't worry about if they're going to judge you. And if you feel like they are judging you, right? If that's something that you observed and that's how you feel, just switch to another primary care physician. That's all you got to do. You don't have to stay and take that. You don't have to endure that. You deserve to be in a doctor's office where you feel welcomed, where you do not feel judged, where you don't dread going to, where you're not canceling the appointments because you don't want to deal with rude medical professionals. You don't have to subject yourself to that. And I have changed physicians. I do not explain anything to the old physician that I'm moving out. I am changing. When you get your new patient paperwork, they, I believe they will ask about where you were before and request your records. I'm not sure if all of the paperwork I've ever filled out have asked that. If I had to take a guess, an educated guess, I would say yes. But I do remember filling out one paperwork where they did not ask me about my previous um, um, doctor, and you do not have to sign the disclosure form to release medical records, because they will have you sign that form to get medical records from your previous doctor, and you do not have to sign that, because what they do is when you do the new patient paperwork, they'll have you sign it just in case they need to request any medical records from the previous doctor, and that way they don't have to ask you at the time they're requesting it, because your release form is already on file. So go ahead and change your doctor. You do not have to subject yourself to rude medical professionals, people who don't want to be there, do not like their jobs, do not want to deal with you, and is, overweight themselves and is judging you for being overweight, who is struggling with neurodiversity, whether it's unipolar, bipolar, being on the autism spectrum, having Asperger's, ADHD combined, or inattentive or hyperactivity. They're maybe struggling with these things, and they, even though they're struggling with these things, or some of them may be even diagnosed and are taking medication for it, and they're so judging you, right? And so you do not have to subject yourself to that. You don't have to um, feel like, these professionals that are supposed to be there to help you are looking at you differently. So I would say for me, a lot of it was all in my head, right? And so when I did open up, they were very eager to help me. So I was pleased with that. But if that is not your experience, just go ahead and change your doctor. It's the best thing that you can do. And this is part 8, guys, of why I suspected neurodivergent symptoms and lied to my doctor. Stay tuned for part 9.